This segment of DelmarvaLife is sponsored by TidalHealth.
The month of November is a great reminder to keep an eye on your lungs and be mindful of your breathing and all things related to respiratory health. That's because November is Lung Cancer Awareness Month.
Lung cancer is the most common cause of cancer deaths among men and women and causes a greater loss of life than prostate, colorectal, and breast cancer combined.
But there are incredible modern treatment options that are looking to reduce that number. We are pleased to be joined by an expert today. This is Dr. Kurt Weiberg. He is a cardiothoracic surgeon with TidalHealth. Welcome to DelmarvaLife.
Thank you for having me back again.
Yeah, so let's talk about this lung cancer. How prevalent is it in the United States?
Lung cancer remains a significant healthcare problem in our area and in the United States as well as worldwide. We diagnose approximately 250,000 cases a year of new patients who have lung cancer. About 125,000 patients die from lung cancer every year, so it remains the leading cause of cancer death in our world, in our region. So it's a prominent problem.
I'm sorry, go ahead.
On a positive note, however, we've made significant strides during the past decade with the diagnosis of lung cancer. So we're going to talk about some different techniques on how we do it and different procedures, different CAT scans, so forth. But we're making actually a dent in this. It was my vision 30 years ago when I came to Delmarva that we're going to make a dent, and we're actually seeing it now in the numbers.
Making the dent. So I'm sorry, I didn't mean to interrupt you. I was going to ask, are there symptoms we should look for?
The symptoms of lung cancer are often too late. So if you want to get lung cancer in its early stage, you have to do things to look for the cancer before symptoms occur. Early stage lung cancer has no symptoms. That's the scary part. However, late cancer, lung cancer has coughing, spitting out blood, wheezing, difficulty breathing. Those usually are representative of late stage cancer, and it's more difficult to cure.
So you're behind the curve.
So have there been some advancements in detecting lung cancer?
So that's where we really have made a significant dent, we call it, over the past decade. About a decade ago, we offered patients who were at risk for cancer that didn't have any symptoms the CAT scan. The CAT scan has changed the game. We are able to now find early lung cancers, and the technology for CAT scans have improved so much, the scans, that we can now detect cancers the size of a pea.
Wow.
I was going to ask you, what is robotic ion bronchoscopy?
It's a new robot, so we'll talk about robots in general, but it's a new robot to detect early lung cancer.
Aha.
Okay. And obviously you use that?
Yes, so let me break it down even further. So with the technology of the CAT scan, what the ion bronchoscopy technique does is we take a CAT scan and develop a three-dimensional GPS tracking system into the lungs so we can know exactly where that small 5 or 7 millimeter pea-shaped nodule is within the lungs. Once we have established that software, that's what the technology does, we know exactly where it is now, 3D GPS system. We use a small 2 millimeter camera to go down the windpipe and wiggle it right to the exact same spot and biopsy that.
Wow.
So it's a robot that does that. So it's a combined technology of advanced software with using a GPS tracking system, and then we use the robot to actually do the biopsies.
So how many, how many programs in this region have this technology?
Great question. About 700 hospitals in the world have this technology. There are only 2 in this Mid-Atlantic region that have it, and we're one of them. We're busy now. We just obtained the technology. We've performed more than 30 of these types of robots. About 8,000 robots in general, but we just started this program.
I was going to say, this fits in with the other robotic programs the TidalHealth is doing?
Yes, so that's our vision. Our vision at TidalHealth is to transform procedures into robotic techniques. So we have a total of 7 robots now within the telehealth systems, 4 at Nanticoke. Nanticoke is now a robotics institute, pretty much.
Wow.
And then 3 in Salisbury at Peninsula Regional. So we have the orthopedic robots, the Da Vinci robots, which does corporeal surgery, and then the latest is the bronchoscopy with the ion that we wiggle down in these small pea-sized nodules.
How fortunate are we? That is so incredible.
About 9,000 procedures now have been performed in this area by TidalHealth with the robots. most of which have been through the Da Vinci robot.
Right.
We're now doing knee replacements, so we have a whole program we've developed at Nanocoke where we're doing robotic knee replacements, hip replacements, and so forth. So about 2,500 of those now. So
That
we're
is
really
amazing.
moving forward. 30% of all of our procedures now are done robotically.
How about that?
So 10 years ago when we started we were 0% were done robotically. Now 30%. So my vision is that we're going to have about 80 to 90% within the next decade. Everything's going to be done robotically now in healthcare.
And when it comes to cancer, you're making the dent.
Dr. Weber, thank you so much for
Thank you.
coming in with all the great news.
Thank you for having me.
How about that?